this morning is drugging elderly care home residents unacceptable, as critics say.
And they try to do their best. And sometimes I'm sure they, as it says, a cup of tea would be as helpful as a drug.
But that
what
requires,
do you do?
That requires time.
It requires training. But on the other side, I'm not surprised there's a cut down the middle, because I've been to these places, and my late mother-in-law had dementia and Alzheimer's, and I've been firsthand seeing what happens and the confusion that comes. And you just hope to God that's not going to be you or somebody that you love is going to be in that situation. So what I also noticed, that if you have one doctor, like a family doctor, dedicated to looking after your personal needs, if you have dementia, your chances of actually not having the drug and actually getting even worse and more confused are much higher. You're actually much better looked after than the general panel of doctors. Yeah, possibly in your own home, if you can afford it, or just maybe one dedicated doctor to that patient. I think it's got a lot to do with training, but it's
going to look to do with money. You know, we've got a growing elderly population.
Absolutely.
And it is a strain on everybody, and they are. I mean, the most terrible thing is they could be the very ones who are having the most suffering.
Yes, well, they suffer, and you can see it right in front of your eyes. The whole thing's happening. I'm really have tremendous hope that's not going to be me, but the chances are pretty strong that we're all, as the population gets older, our bodies can be, looked after by medicine, but they haven't really figured out too much recently about the brains, and I'm delighted that this has come to the forefront. Mental illnesses and stuff like schizophrenia. People are talking about it. I had my great aunt suffered seriously for dementia, but nobody knew what it was. They just thought that she was bonkers.
Yeah, that's the day it was dismissed like that. It's quite interesting. It's worth mentioning that last week we were looking at prescriptions for antidepressants to children and how many children are being drugged.
Inappropriate prescriptions for dementia drugs every year. Is it 80, 800 or 1,800? Find out after the break. So how many deaths does the Department of Health estimate are caused by inappropriate prescriptions for dementia drugs every year? The answer is 1,800.
Edging up to the same number of people killed on our roads.
And is that like some sort of crimes being committed? It's like Soylent Green. It's a bit like, oh,
it's not good.
It's not right, is it?
Welcome back, by the way. You're watching Thursday's Right Stuff with Mark Little, Susie Amy and Christopher. Chris is going to bring you all the other headlines shortly. Stories they include pardons for men convicted under old anti-gay laws. And we're going to shame the businessman who robbed a disabled lady of her train seat. But right now, I want to know how you feel about using powerful antipsychotic drugs to sedate elderly care home residents. 0207 173 5555, the number for your stories. As we heard before the break, around 100,000 vulnerable people are being given old-fashioned pills like chlorpromazine designed to treat schizophrenia, despite a government review back in 2009 frowning on the practice. Critics worry carers are using these drugs not really for the patient's benefit, but so that they themselves can get a good night's sleep. Others, though, argue these drugs, not newer treatments for dementia like memantine, are vital when dealing with unpredictable and sometimes violent patients. The phones are ringing off the hook, so what are people saying, Rosie?
We have Lisa on line one.
Good morning, Lisa.
Yes, good morning, Matthew. Good morning.
What would you like to tell us?
I'm a nurse. I work currently in a hospital and I was not have experience in nursing home. I would say unless it's absolute the last resort to actually use these drugs,
right,
and needs to be assessed on a daily basis. It wouldn't be advisable to give the patient this drug, for example, in the morning and you treat it continuously the whole day and the next day, and you will go and give the same dose tomorrow. That's just inhumane. It needs to be constantly reassessed. Constantly, the dose needs to be titrated on a daily basis, not like 6 weeks when the patient is like a zombie.
Well, this is how, I mean, you're outlining how these drugs should be used, but this multi-university study, 5 universities found that in 5 residents' cases, they weren't being treated properly. They weren't being treated along these lines.
That should be a recommendation before the drug is actually being prescribed. It should be something that needs to be followed, that it needs to be assessed on a daily basis, like with any other medication that you would give any.
Okay, well, I understand that, Lisa, but can you explain why 1 in 5 care home residents is being put on the drugs for either too long or because they don't need them? And I mean, this is quite a big study, intensive study, and it's found some worrying practices out there.
I think
I mean, if there was a 2009...
They're not doing their job properly. Maybe they're not doing their job properly because as a prescriber, if you prescribe a drug, it should be monitored. It should be monitored closely, especially those kind of drugs.
So people aren't doing the monitoring. Is that the GP's fault, the care home manager's fault?
It's both. It's both, because there should be a follow-up from the GP to the nurses and the nurses in the care home who's giving the medication.
Right.
It should be the nurses constantly assessing the patient on a daily basis.
Okay, now 2009, the government publishes a review in which they've identified that some carers in some homes are essentially drugging residents to keep them quiet. That's 7 years ago. And today, or yesterday, it was published that 1 in 5 care home residents is still being treated badly with these drugs. Are care home managers and doctors not paying any attention? I mean, do they need some kind of kick up the backside?
I think so. I think so. Because, for example, I wouldn't continue that practice, getting a patient like completely in a zombie state. So it needs to be a multidisciplinary assessment with these patients. So that's why practice just keep going on.
Okay, Lisa, you're making it very clear. Checks and balances are the key to using these drugs safely. Thank you. Let's have another.
Laura is on line 3.
Good morning, Laura.
Good morning.
What do you know about sedation in care homes, Laura?
I know it from the point of view of having an elderly uncle that was admitted to a care home. Now, I looked after him in the home for about 7 years, so I knew exactly what his state of health was. Right. He was admitted into a home, and within literally 6 weeks, he was salivating. He was, sleeping lots during the day. He himself, on the days that we went and took him out, for dinner and things, would comment on, he was apologising, I'm sorry, I don't understand why this is happening. And I found out that because he was a little old man and he used to get up a lot in the night to go to the toilet, as happened, the staff didn't like this, and he was being heavily sedated in the evening so that he would not be able to get out of his bed at night. And this was then, affecting him during the day, and he just went rapidly downhill and was gone within 7 months of being in that home.
Did you raise concerns with the home?
Yeah.
And their explanation was?
He needed this medication, and I'm thinking, well, he didn't need this medication when, he was being looked after at home. He just used to get up and go to the toilet, but they didn't like it that he wandered about at night, and they had less staff at night, and they didn't like having to deal with it. And
no violent episodes?
No. He was just nothing like that. He was literally, in the home because he was 90% blind, and it was just harder for him to be in his own house.
Right. A worrying story, Laura.
No other health thing. Also, when he was admitted into hospital, I mean, it's slightly different, but just on the care home aspect, when he was admitted into hospital and I was called in, he was actually admitted into hospital severely dehydrated. And I've never been able to get my head around how somebody in a care home facility can be dehydrated. And when it was raised with the Care Commission, they told me that all the appropriate forms were ticked. And that,
if all the appropriate forms have been ticked, Laura, I mean, there's obviously nothing to worry about.
Yeah, exactly. I was like, so somebody going into his room, ticking a form means that elderly old man has actually had somebody put fluid into his hand and watched him drink it.
Well, it's like Chris was saying, sometimes all someone needs is a conversation, a bit of engagement, and that's not ticking a box.
No, exactly. And there was times that I would go in, and he was 90% blind, and I would go in, and his meal was sitting on a table beside him, and he didn't even know it was there.
Laura, very, very distressing call. I have to thank you, and I want to move on and get one more because time is short.
We have Jackie on line 2.
Good morning, Jackie.
Good morning. Hi.
Hi there. Your thoughts?
I think there's 3 points of responsibility with this. So we'll start with the care home themselves.
Yeah.
They are aware, as you pointed out, from 2009, that these drugs should be eradicated from care homes, and many care home operators have deliberately set about different methods to reduce and remove these drugs.
Okay, next point.
Then the CQC, the Care Quality Commission, do close care homes down,
Yes, they do.
or make points to refer back to improve situations with regard to medication. And the third one, of course, is nobody can get these drugs without a GP.
No, they can't. No, they can't. Jackie, I'm going to let that last line hang in the air as we go to a break, because you're absolutely right. That's where the responsibility lies. But after the ads, it's Chris with all the other headlines, including pardons for men convicted under old anti-gay laws.